A lot of parents believe that teething can cause fevers, diarrhea, and runny noses, but this is actually not the case. This is just one of the many teething myths that can lead to unnecessary frustration and pain for you and your little one. Also, some of these beliefs can lead to a baby becoming injured or harmed. So in this video, I'm going to dispel the teething myths so you can avoid making them and hopefully make that teething process a whole lot easier. But before we do, make sure you click on that free PDF document in the description box below, which covers the developmental milestones you can be expecting for your little one in their first year of life. This will give you an invaluable peace of mind, as you'll know when to be expecting skills and when to be concerned. The very first myth is that teething causes fevers, diarrhea, or runny noses. Now, studies have shown that when a baby is teething, there is a very slight increase in their body temperature, but it does not result in fevers. So if your baby has a fever, so their body temperature is over 100.4 degrees Fahrenheit or 38 degrees Celsius, then it indicates that they may be fighting an illness or have an infection. Blaming teething on fevers, diarrhea, and runny noses can delay you seeking appropriate medical advice to treat infections such as ear infections, urinary tract infections, or other illnesses that are causing your baby pain. Proven symptoms of teething include swollen gum tissue or an eruption cyst, which is a blue-green bubble that happens on the gum just before that tooth erupts through. They also generally have some gum pain. So this might be really mild or not even present for some children, and because of that gum pain, children will tend to chew a lot more. And when they are chewing, they are also going to dribble a lot more because it just comes right on out of their mouth. Now, because they are dribbling, there is also going to be a dribble rash. And that's because in the dribble, there's some food which is causing some irritation to the skin. Generally, kids who are teething may also be a bit fussier, and they may change their diet just for a little while so that they might prefer softer food, or they might actually prefer food which is more difficult to chew to apply pressure to their gum. The second myth is that the teeth move up and down in the gum. Now, once a baby's tooth erupts, it doesn't disappear back into the gum. What parents are noticing is that the tooth has erupted and then there is some localized swelling around that tooth, which makes it look like the tooth is disappearing. And then as that swelling resolves, the crown of the tooth becomes more apparent. The third myth is that babies' teeth arrive in a random order. So babies have 20 teeth that are resting below their gum line, and they generally appear in the same sequence. So firstly, you would generally see the central incisors, then the lateral incisors, then the first molars, canine teeth, and then you will see the second molars. Now, it doesn't matter if your baby's teeth come out of order, but knowing the general sequence that a baby's teeth will arrive means that if you are suspecting your little one is teething, you can check that spot to see if you can see any teething signs like that swelling of the gum or that eruption cyst. The fourth myth is that teething gels are safe. So teething gels or numbing gels should never be used, and that is for 3 reasons. The very first reason is that generally they are ineffective. So babies who are teething are dribbling a lot. So basically the medication either washes straight out of their mouth or they end up swallowing it. Now this leads me on to the second reason it shouldn't be used, and that is because if a baby is swallowing the numbing agent, then it means that the back of their throat can potentially be numbed, and that can result in some difficulties around swallowing. And lastly, the numbing agents in the teething gels like lidocaine and benzocaine has been linked to causing potential injuries in babies when it is swallowed too much. So if parents are applying it frequently and the baby swallowing a large amount, it can result in some injuries. So for example, lidocaine, which is often in teething gels, can lead to a baby experiencing severe brain injuries, seizures, or a heart problem if they have swallowed too much of it. The fifth myth is that teething necklaces and bracelets work and are safe for your baby to wear. Now, unfortunately, there are a lot of unsafe teething products out there, and one of them is the teething necklaces and bracelets. Supposedly when a child is wearing these, the beads themselves or gnawing on the beads provides the baby with some relief. but there is currently no evidence to suggest that this is true, and in fact teething necklaces and bracelets, which a baby wears, has actually been proven to cause hazards for a little one. So it can pose a choking and a strangulation hazard. Now, if your baby is experiencing some teething pain, then there are some things that you can do, and you can find out exactly what they are and which ones I recommend by clicking this video here. Now make sure you click on that free PDF document in the description box below, and I will see you next week where I'll share more parenting tips and tricks.